Now today we will be dealing with the questions asked in FMGE from microbiology. So our focus is microbiology. Now let's go straight away without wasting time, and I would like you to have a look at some of the questions, and these are some of the images from my book. So this is NEET PGQR and FMGE Platinum QBank, which is there. So first of all, there is something you have to remember: Staph aureus. I mentioned it over here. That's one question. The second question is measles. I will be coming across the questions which have been asked. This is just to give you a rough idea that I had planned this book, and from this book I expected something, and the strike rate of 90 to 95% as far as the questions I had expected. Now, third question, amoeba, then IgM antibody, remember these things, then dengue, then Pneumocystis carinii, sporotrichosis, staph. Now, this prick rose Gardner's disease, Clostridium perfringens, influenza virus. Now, so these were some of the images from the book which is there. Now, I come to the questions which have been asked. So, first of all, the question which was asked was, after eating salad, a patient presented with diarrhea. So, two things. The patient is taking salad. Now, why is this important? Because different foods cause different types of diarrheas, and ingestion or contamination of different types of foods cause different. And the period, the diarrhea occurs within 3 hours. It is basically, it is not 3 years. So I would just rectify this thing. It is 3 hours. And if a patient takes a salad and he gets diarrhea after 3 hours, so issue is, what are the causative organisms? So we have a host of choices which were given: Bacillus cereus, Vibrio, Parahemolyticus, and Brucella. Now, basically, as far as acute diarrheas are concerned and salad, we have got the Staph aureus, which produces a diarrhea within 6 hours of intake of salad. So that's very important, the type of food which is taken, and whether the diarrhea occurs over a long period of time. Now we have these diarrheas, and they're very important: rice water stool, fulminant diarrhea, going into severe diarrhea and a shock, characteristic of Vibrio cholera, which is a important entity, and once cholera cases are detected, it has to be reported immediately to the authorities. So then is Bacillus cereus. There is something association with fried food. That's important. But over here it is salad and diarrhea occurring within 3 hours. So that is Staph aureus. Now another question was, HIV positive individual with CD4 count less than 65 and bronchoalveolar lavage shows head-shaped structures. So there are two things. Some students refer to head-shaped structures, and some structures students point to pinball ball appearance. So that's important. So you have to remember that in case there's an immunocompromised patient who has got CD4 counts less than 60, and there is a characteristic microbiological finding of these pinball appearance or a hat-shaped structures seen on bronchoalveolar lavage, that is very characteristic of Pneumocystis jirovecii infections, previously called as Pneumocystis carinii. I was not sure about whether the choice given was Pneumocystis jirovecii or Pneumocystis carinii, one and the same thing, but the latest nomenclature is Pneumocystis jirovecii. So you have to remember that thing. So first question, Staph aureus causing acute diarrhea. Second question, in an immunocompromised patient, head-shaped structures on BAL, and they are Pneumocystis infection. Now third question, Sporothrix, Chickney, and it was a rose Gardner's disease, a pinprick, and then this cutaneous lymphangitis and Gardner's disease, and then asteroid bodies. it is very important to remember that the microbiological feature of sporotrichosis is asteroid bodies. And it was mentioned what is the culture media. You have to remember that subdots agar is the STA, is the culture media, because eventually this organism just thrives and grows on this agar. That's very important. This was a question asked. Cult media, it's very important to remember certain important media, Pikes media, algae media. We have got so many blood tellurite media. What organism grows on what media? That's very important. Now, another question, HIV positive individual with diarrhea, with sporocysts. So as far as HIV positive individual is concerned, and it was mentioned sporocysts. Now there are many organisms which have got association of diarrhea in an immunocompromised patient. But the thing is that the sporocysts were given, and among the choices mentioned, the only organism which can have cysts in the form of microbiological feature in immunocompromised patient is cystospora. So that is very important. You have to remember because there are these HIV infections and there are certain important characteristic diseases which are associated with HIV, say tuberculosis, pneumocystis infection, which we just mentioned, and this important thing which causes diarrhea in adults. Now, a very simple question which was asked: female who had used tampons during her menstrual cycle, and then she presented in a shock. The clinical scenario was of that, and this thing, I don't think that any student can get this wrong at this level. So it is toxic shock syndrome, and the Staph aureus is the causative organism. Now you have to remember these things like Staph aureus, what it is implicated in, what diseases it causes. So as far as staph is concerned, you know, we have just in the first option saying that it causes acute diarrhea, number one. Number second thing is that it causes toxic shock syndrome, number two. Number three, acute osteomyelitis, that's very important. Acute mastitis, that's very important. Acute bacterial endocarditis, very important. These are some of the very important diseases in addition to many more diseases which are there. So female, tampon use, and Staph aureus. Now another question, myonecrosis is caused by which organism? So important to remember Clostridium perfringens. So there were choices given, myonecrosis and gas gangrene. They are a feature of clostridial infections. Then this question, HPV in head and neck cancers. I have mentioned this in my other video, and there's a classic association of HPV with CS cervix and other respiratory juvenile papillomatosis. But here the important thing is that oropharyngeal cancer is very important, the most common. Now neuraminidase and hemagglutinin are associated with viruses. There are many viruses which were given, and you have to remember a characteristic association of influenza virus. That's very important. Measles belongs to which group of virus? That was a question asked, and it is the paramyxovirus. That's very important. A patient with poor lens hygiene, and he gets keratitis, and what organism causes keratitis is acanthamoeba. You have to remember that acanthamoeba is associated with poor lens hygiene and the keratitis. Now, pneumonia and diarrhea after unpasteurized milk. A patient had consumed unpasteurized milk, and after that he got pneumonia and diarrhea. You have to remember that among the choices, Coxella burnetii is the organism which was causative. Now, as far as hypersensitivity reactions are concerned, there was this question about hypersensitivity reactions, that hypersensitivity in lepra reaction. The question was not mentioned lepra reaction, because lepra reaction in itself is type 1 hypersensitivity. But the hypersensitivity in lepra reaction, that is a delayed type of hypersensitivity, there's a type 4 reaction. So that's very important. You have to read the question lines very carefully. Now, first antibody to rise, I don't think there's need to mention, it has been repeated many times. So many times, hundreds and hundreds of times, and that means this question is very asked. IgM, you know, you have to remember the features of IgM, IgG, IgA, IgD, IgE. So that's important. But remember, earliest antibody and the earliest to rise, and the first antibody is IgM. Very important. Then there was a case of a patient with a severe fever, retroorbital pain, and arthalgias, and intense body pain. And basically, a patient who has got arthalgias, intense body pain, is usually having this dengue hemorrhagic fever sometimes, but the question was not dengue hemorrhagic fever, it was dengue, simple dengue fever. So that is one important thing you have to remember. Now, going across, I showed you at the onset of my class that there are these things. Now see, this is an images which I showed. Already question number 1, you can see, this is the first question I have put in microbiology in my platinum cure bank. And the first question was, Staph aureus causes food poisoning, and that too within 12 hours. Very important. Acute diarrhea, crampy abdominal pain, and that is, I have given a full scenario. Over here you can see that I have given a full scenario, and the scenario was asked in the exam. So question number 1. Now again, I just go and measles. The question was, this is a question, I have not put the same question, but measles belongs to RNA paramyxovirus group. That's very important. That was the question which was asked. I have put up in explanation. So if you read the question well, the explanation well, you can answer the questions. Now, a 26-year-old boy developed infection using contact lenses and keratitis with poor hygiene. And I told you, Acanthamoeba castellani is the organism which is most commonly associated with this thing, although Acanthamoeba can cause meningoencephalitis as well. That's a question which is also asked frequently. You have to remember that. But here, keratitis in contact lens wearers, I have mentioned it. The question has come straight away as a line. Now, IgM I was mentioning, acute infection, and the first antibody to rise, whether it's any infection, here I have mentioned the reference of hepatitis A, but infection, but here IgM antibody is there. So you have to remember IgM is the first and indicates acute infection. Now, dengue virus, I have given this as a clinical scenario. You have to remember that this dengue virus is transmitted by Aedes mosquitoes from one human to another, and a patient can have high-grade fever, severe bone pain, which I mentioned in my earlier few sentences I mentioned about dengue. So you have to remember arthalgias, retroorbital pain, high fever, and that can be associated with dengue. Now, pneumocystis I was mentioning, immunocompromised bronchoalveolar lavage in a patient who is immunocompromised and hat-shaped organisms. I mentioned this, I emphasized upon hat-shaped structures in the bronchoalveolar lavage, and that is a characteristic feature of pneumocystis in immunocompromised patients. Then I mentioned you sporotrichosis, and sporotrichosis I have mentioned in my one line of my notes, culture on this agar, which was mentioned over here. So this is the choice. This is how we answer the questions. Then staph toxic shock syndrome, I have given in the question, a female is using tampons, develop shock. Toxic shock syndrome is the diagnosis, and nothing much. This I mentioned. That's it. Then I told you this sporotrichosis, which was earlier given, that the agar media which we use, that's already there. Then bionecrosis, I mentioned it in brackets. This is the Clostridium perfringens causes myonecrosis and gas gangrene. Then again, hemagglutinin and neuroaminidase associated with influenza virus, nothing much. Then I have given a full detail about these things. Simple question lines answered. So this is the crux of the microbiology. What was asked, where from the questions were asked, and how standard text helps you. So I hope that you have fared well, and for the students who are to appear next time, I hope that they will go through what they have missed last year. And new students, I wish them good luck. Thanks a lot.